Hello everyone, I am Dr. Saravana Krushna, Thoracic faculty from Doc Tutorials, and Dr. Murali will be waiting beside us. He is a vascular surgeon. So we both will be discussing about how to prepare for your INA examination. So cardiothoracic and vascular surgery will be an untouched topic. So we will be here to guide you on how to prepare and how to approach and what are all the books to be read before your examination. So first of all, the preparation between NEET, SS and INI varies because for the NEET SS, you will be asking, say, about only about 20 questions from out of 150 or 180 questions. But in INI, there will be 70 questions purely from cardiothoracic and vascular surgery, and merely 10 questions maybe from general subject. So this is what our previous friends who have been cleared INI have been discussed. So coming to the preparation, you should be read in depth. For NEET SS, the basic books like Bailey and your Sabiston, surgery Sabiston or Schwartz will be enough. For preparing an INI, you should be read in depth about the cardiothoracic facts and the vascular facts because many questions that has been asked in the previous years has been it is really asked in depth because the many questions have been asked from the names of the surgeries and the famous personalities in cardiac surgeries have been asked. So for INI, there will be 80 questions. So out of that, at least 70 questions will be asked from the specialty. So what are all the topics you need to cover and what are all the books you need to read? As I said, the basic books you should be thorough will be Bailey and Love, Saviston, Schwartz, and few points about embryology from Langmans. Regarding the cardiothoracic books, if you people really have time, you need to prepare from Sabiston and Spencer cardiothoracic surgery, Kirkland cardiothoracic surgery, Shields thoracic surgery, and Maurodis and Perloff for pediatric cardiac surgery. According to the recent questions, most of the questions, I mean, about nearly 20 to 30 percentage has been asked from aorta, mainly from thoracic aorta, abdominal aorta. Many questions have been asked from dissection and aneurysms. What are all the topics that has been focused in the recent IN examination means they have framed majority of questions from aneurysm and dissection, and the classification, DBK classification, Stanford type A and type B, they have been asked. So, and regarding the history, yes, a few questions has been asked from the history. So you should be clever enough to read about the history of cardiothoracic and vascular surgery. And I also noted a few questions has been asked in a scenario manner that a situation will be given and you should be keen to answer for that level. Example, a patient came with hypotension, elevated JVP, and muffled heart sound. Like that, clue will be given. That is the Bextriad. So, the patient will be diagnosed of a cardiac tamponade. In that, you should know the Bextriad. You should know the symptoms. You should know the presentation. Like that, questions will be there. So, at least 3 or 4 lines will be the question. So, you should concentrate adequately to answer the question. And in each and every question I have noted in the previous years, there will be definitely a clue. So we have been clearly discussed all those about concepts in the recorded class sessions. And coming to the next concentration of your subject means surgery names has been asked. So recent Bailey has been added few surgery names, and that has been asked in your INI. Example, for the aortic valve repair, few names has been asked. Like that, surgery names and types of surgery you should be get familiarized. So those types of questions and answers we have been completely framed in the recently recorded doc tutorials recorded videos. And coming to the general questions, so on cardiothoracic, you should read in depth. As far as recent examination is concerned, many questions has been asked from thoracic aorta, and the history and the scenario-based questions have been asked. But this won't be similar in the upcoming years because what we have been observing for the period of 10 years, If 1 year people are taking questions from thoracic aorta, means next year they will be asking from congenital heart diseases, and the next year they will be focusing only on I mean lungs, pleura, and mediastinum, like that. The questions are coming. So there is no any important topics when considering the IN examination. So you should know the all subjects and all lessons, and you should read in depth. So for your sake, we have covered the entire discussion in the online recorded videos. And coming to the general questions, so at least so 10 to 50 questions you will be asking from your general surgery. So in the recent examination, what type of questions have been asked? If you ask, means the questions have been asked from gastric ulcer, the types of gastric ulcer, CA breast, male CA breast questions came from the male CA breast, and you should also spend enough time in understanding the statistics, specificity, and sensitivity of certain investigations or certain treatment. So likewise, you need to concentrate. So regarding the INI cardiothoracic, remember, majority have questions asked from the specialty only. So general questions, I hope you people can easily answer. So in INI, which is the best institute to read? Obviously, it will be AIMS. In AIMS, they will be having an interview. Interview will be there only to assess your depth of knowledge. Um, Recent interview in AIMS, what they have been asked means, in the recent interview, they have been asked about the mechanical valves. What are all the mechanical valves we are currently using in our country? Like that, they have asked like St. Jude. You should be get familiarized with the names of the valves, mechanical valves like St. Jude and TTK Chitra, like that. You should know. And the CPB machine principles has been asked. So we have been clearly explained the CPB principles and the function of CPB, the complications of CPB in the recorded sessions. And the questions have been asked from the anticoagulants. So what are the anticoagulants we'll be using before the start of a CPB, and what is the PT-INR ratio we should maintain? So what is the ACT we have to maintain? At what level of after what level of ACT we should start the CPB? Say after 480 seconds we should start the CPB, and how to reverse the action of heparin, like we used to give protamine, in what ratio we'll be giving, in the ratio of 1:1.3 or 1:1. So these questions have been asked, and few questions have been asked from the pregnancy and the prosthetic valves. Suppose the patient have received the prosthetic valve and um, the patient is pregnant. So how can you manage INR, whether to continue oxytrom or not? How much teratogenicity will be there? Like that, such questions have been asked. The first trimester, second trimester, and third trimester. So current indications shown that INR of maintaining INR of less than 5 is very essential with the onset of to avoid thromboembolic complication. Injection heparin will be very beneficial in the first trimester. Second and third trimester, the acetrom will be having its own role. Likewise, such just I am pinpointing few questions so that you should be able to concentrate while reading. And last but not least, the images of cardiothoracic surgery personalities you should understand. I have shared about 10 images in the recorded session. So among that, one a personality has been asked in the interview. So get yourself familiarized with the images of the personalities so that you people can definitely crack the INA examination. INA is no more difficult, so we will be there to support you in doctor tutorials. Yes, we will be sharing a video, a short video, so that you can have an idea how we will be discussing in the session. Yes, you can play the video. Uh, can you switch on the video? Audio is not there.
So aneurysm. So what are all the types of aneurysm? True aneurysm and false aneurysm. What is true aneurysm? That is localized dilatation of blood vessel involving all three layers. What are the layers? Adventitia, media, and intima. Right? These all layers will be involved in true aneurysm. Among it, there comes the saccular and fusiform. What is saccular aneurysm? This only a part of circumference of the vessel wall will be involved. In fusiform, the whole circumference will be involved. So these are all the types of true aneurysm. And coming to the false aneurysm, because of different intima, what happens? The blood will extravasate, and because of the surrounding structures, it gets contained and appear like an aneurysm. This is called as false aneurysm. This may occur following a trauma, dissection, or previous surgery. And to point note that it has compressed supporting tissues at its wall. Right? Again, these diagrams will be helpful for your understanding. In true aneurysms, all layers will be involved. In false aneurysm, because of the defect in intima, the blood extravasate and contained here with the help of the external supporting tissue. And not to forget the dissecting aneurysm, right? What is the dissecting aneurysm? Again, because of a tear in the intima, the blood enters between the media and the intima, right? Etiological factors in aneurysm. The first and foremost will be atherosclerosis, then connective tissue disorders like Morphans, Ehlers-Danlos, Loeys-Dietz, osteogenesis imperfecta. All these constitute the formation of aneurysm. Tertiary syphilis, which is rare nowadays, and trauma may also cause aneurysm. What are the indications of surgery in aneurysms? A progressive aortic valve insufficiency, because aortic cusp has been attached to the aortic valve only, the annulus. So once a dilatation of aorta occurs, it may cause aortic regurgitation or aortic incompetence. And next, coming to the diameter, when to intervene? If it is ascending aorta, we should intervene when the size is more than 5.5 centimeter. If it is a descending thoracic aortic aneurysm, we should intervene when the size is more than 6 centimeter. And in such conditions like Morphans or Loeys-Dietz syndrome, we have to intervene even the size reaches the threshold. So it is very important for your MCQ point of view. So kindly go through this. Next, we can move on to surgical options for aortic aneurysm. What are the options available? We can put an interposition graft, Dacron graft, or we can do a Bentall procedure we will be discussing. And we can also do a debranching techniques. We can also do endovascular techniques, which I will be discussed vastly in the upcoming slides.
Yeah. Likewise, we will be having plenty of videos. We have covered the in-depth subject, so it will be very, very simpler for you to understand to crack the examination. That's all from cardiothoracic surgery, and Dr. Murali will be waiting to discuss about the vascular surgery topics. Welcome, Dr. Murali.
Hello, sir. Thank you. Good evening, friends. I'm Dr. Murali, vascular endovascular surgeon. I believe Sir has already told you regarding how to prepare for the questions and exams and how the questions are asked. So regarding vascular, I think one textbook apart from Bailey, Schwartz, and Sebastian, one textbook you should read is Rutherford's textbook of vascular surgery. In INISS examination, the area which has been commonly focused is aortic dissection, aortic aneurysm, and the endovascular repair. Endovascular repair is the newest kid in the block. So there has been a lot of questions because since it is a new procedure which has come to fore, there has been questions asked regarding that. So you need to know a little bit about what are the basics of endovascular and how the EVAR and TVAR procedures are being done. We have discussed with the diagrammatic representation in our online class materials in the doctoral video, which has been soon to be uploaded. From the vascular perspective, already cardiothoracic videos are there. And along with that, you need to concentrate a little bit on the venous side as well. So we are not going to ask you about varicose veins, but you need to know a little bit about the drugs, how do you complicate of risk of thromboembolism, what are the, as Sarah has mentioned about heparin, you should also know about newer drugs and you should know about how they are being managed. So once you guys are well versed with the basic textbook of Bailey, Sebastian, and Schwartz, I think you should concentrate more on cardiothoracic textbook and vascular textbook. and you need to choose the topics. It is not imperative to read all the topics. So the topics which have been covered in Bailey and Schwartz and Subiston, you need to read it in detail in those main textbooks. For example, if there is a mention about aortic dissection or aortic aneurysm in Subiston and Schwartz, so you need to learn a little bit about EVAR, a little bit about aortic dissection management in Rutherford textbook of vascular surgery. Same way in cardiothoracic as well. And we are going, there has been paid classes have been uploaded in the doctor tutorials. They were available in the online video session, and we will be taking regular classes as well, and we are there available to clarify your doubts when and when you have any. And we will be conducting some test sessions. You can discuss those questions. You can ask them why the answer has been chosen this over the other one. We are not, you need not concentrate on the very fine details. We need to concentrate on facts. You need to concentrate, know the numbers, but they are not going to don't be be a little broad-minded. They are choosing a person who is going to become a cardiothoracic surgeon. So you need to get the facts right, but it is not mandatory that you need to break your head over some of the facts which are being moderately. Bailey may say one number, Subiston may say a different number, Schwartz may say a different number. But if you have the idea, clarity is good. Say, for example, just now Sarah played a video and in which he has said about the aneurysm and the threshold value wherein we repair. And if you know that the threshold value is less when the connective tissue disorder is there, because that chance of rupture is higher, then they are not going to penalize you. It holds good even for the interview as well. So I believe they are going to be there with you till you crack the exam, till you take up your cardiothoracic and vascular surgery specialty, and we will help you along the way. And we'll be very glad to have you in the part of the team. And feel free to ask us any doubts regarding cardiothoracic vascular questions. We'll be happy to clarify them in detail for you. Sir, do you want to add anything else, sir?
Oh, yes, sir. Oh, definitely. You covered everything. Yeah, we will be there. Both of us will be there for your clarification of the doubts. We will be having monthly sessions also, along with the recorded videos. Definitely, that will be having, you will be having doubts. So we will be there to clarify your doubts, and we will be selecting some important topics, and we will be discussing at every month. So it will be very useful for you. And by attending a doctor drill session, you people can definitely crack your examination. INI. Yes, that's all. So proud
Thank
to
you.
have you
Thank you for
all, you
listening.
guys.
Sir, go ahead, sir.
Oh, yes, sir. Okay. We will be seeing in the online session, sir.
Sure. Looking
Thank you,
forward
sir.
to meet you guys and clarifying your doubts. Okay. See you soon.
See you soon. Bye.
Thank you, sir.
All the best, everyone.